able to answer some questions, at least in public. They, I think, have said they would be willing to do it privately because of the issue of antitrust concerns, but the providers didn't show up as well as we would have liked to have seen. I think that's going to be changed in March. The hearings, the big hearings, are in fact going to be held, and I'm hopeful that providers and the plans will be very active and involved in those hearings and help us to get to what are the cost drivers and other things we can do short of setting rates, which I don't think necessarily works very well, because it's the same thing that goes on in Medicaid and Medicare, where rates are set without really regard to what the costs are and how to deal with them. And we do need to look at what all of the providers and the plans. One of the things that I hope they will answer, as well as not only what's driving the cost, but what are they doing about it to try to keep the cost down, to be more efficient as a provider, to work better and develop better contracts. Because we've found, and I think the hearings will reveal, the investigations that have been going on now, looking at contracts between payers and providers, is that it's largely, the price is largely driven not by quality, but by market share. And in the greater Boston area, there's one major provider that dominates the market and pretty much tells the payers what they'll accept. As you get outside the Boston area, there's one major insurance provider that dominates the market and typically tells the providers what they will accept. And there's not necessarily a correlation between what they charge and what the kind of care they deliver. And that's where we need to focus, I think, on improving the quality and efficiency of healthcare and making sure that it gets passed on back to the consumer, not simply added to somebody's salary or profit margin. The new Senator Moore, along joined with the original Senator Moore, in co-sponsoring a bill that we have before the Committee on Healthcare Finance that really focuses on the issue of small businesses, the large, mostly under 50 employees, and looking at actually capping the profit of the provider to no more than 110% of Medicare rates. Now that's Medicare rates as they are now, because we don't know what they'll be with national health reform if that passes. And insurance profits, or surplus, it's known as at 2.5%. That bill, if it were to be enacted, although it's not necessarily enthusiastically embraced by all the providers, would result, they believe, in about a 22% reduction in premium rather than the increases we're seeing. So we do need to focus on that. Might not be the exact solution, the best solution. We need help perhaps further refining it to make it work. But we are making efforts, and as Michael will talk a little bit about some of the oversight hearings that we have in mind, and his committee has already been doing some hearings on the issue of small business, because it is in Chapter 58, our health reform, as we merged small group and non-group, it did help to some degree the individual market, the non-group market, but it increased the small group more than it was anticipated. The studies, the actuarial studies we've done at the time showed a modest increase, but that's far from modest now. So we do need to focus again on that particular part of the business as we look at the overall issue of cost and quality. On the national plan, there is most of what we've done in Massachusetts. In fact, with the issue of prior condition, not banning somebody having insurance because of a previous health condition, or perhaps capping your annual or lifetime benefits, are something we've actually had since the late 80s with one of our earlier health reform initiatives. So our insurance providers in Massachusetts are used to that. It's kind of a shock to some of the other, particularly many of the for-profit companies around the country, but we won't see any real change in that. It simply will continue to do it as we've done. But the issue is on the funding side that we could be hurt, because and not only Massachusetts, Vermont, Maine, Iowa, there's about a dozen states that actually did something to expand access to care, and may not get the benefit, depending upon how the final plans work out in Washington. There's one other piece besides that. I know Senator Kerry's been very active in trying to get some assurances that we will get recognized